Hi, I'm Dr. Prashant Chhajed, a chest physician at Fortis Hiranandani Hospital, Vashi, and today I'm connecting with you with regards to the launch of the Alair Bronchial Thermoplasty system, which is the first installation in Western India. The bronchial thermoplasty is a procedure that is performed in patients who have severe asthma. The question is, why bronchial thermoplasty? In patients with severe asthma, there is a hypertrophy of the airway smooth muscle. So the airway smooth muscle which surrounds the airway is what contracts and reduces the airway lumen whenever an individual with asthma is getting an asthma attack, and because of this narrowing of the airway lumen, a patient who has an exacerbation of asthma has breathlessness or wheezing. So bronchial thermoplasty is a procedure during which a catheter is passed into the airways via a bronchoscope and a controlled heat is given to the airway wall using radio frequency. This controlled heat reduces the airway smooth muscle mass by around 30 to 50%. Once this hypertrophied airway smooth muscle mass is reduced, then whenever this individual gets a symptom of asthma or an exacerbation of asthma, the airway will not contract as much as it used to when the smooth muscle was much more stronger or much more hypertrophied. And as a consequence, this individual has asthma, will have less symptoms, will have less exacerbations which need to take him to the hospital, or less exacerbations which will need for him to go to the emergency room for emergency treatment, and will allow him to have a better quality of life. Certain patients who have severe asthma, following the procedure of bronchial thermoplasty, will have or lead to a reduction in the use of their medication. And this procedure of bronchial thermoplasty is performed over 3 sittings. And these 3 sittings are done at typically a 3-week interval, during which different parts of the lung are subjected to bronchial thermoplasty. I hope that this short introduction gives you an overview of bronchial thermoplasty, but the important message is that bronchial thermoplasty is not a cure for asthma. It's an add-on to the therapy, which are the existing therapies which the patient is taking, such as the inhaler therapy. So this is an add-on to an inhaler therapy for asthma to control the asthma better, so that the quality of life of the individual is better and the patient is able to have less time off work, will need to visit the doctor less frequently in an emergency situation, or will need to be hospitalized less compared to what he was having before the therapy. Thank you very much.